Okay. Hi, everybody. Sorry for the delay. Let me see. Actually, I don't know. It says attendees are still on hold. Oh, start broadcast. What? Star one to start broadcast, and it says it's not valid. Why would that not be?
I can see your screen.
You can? Well, I did just show screen, but it's not starting the broadcast, I think. Audio. Oh yeah, that's the only problem with you guys seeing the screen. Then you also see my controls, don't you?
Yeah, I think so.
Hey Liz, it's Michelle. I'm back. Sorry
Hi.
about that.
It's okay.
Hello.
I can't start the broadcast for some reason. Can you try pushing star one or something? I don't know why. It's not valid. I have no idea. Maybe it's because I didn't. I'm going to try to get off of here and call back on my phone and see if it's because I didn't enter an audio pin or something. Let me try that.
Do you want me to try to do it or just wait for you?
Just wait because you're not organizer.
Okay. Okay.
Yeah. Okay. Bye.
Technology is so much fun.
Yes. I can send a message to everybody. Let me see.
Okay.
Maybe. Oh, but there's no choice. Send chat to organizer, presenter. I don't see an option to chat with everybody.
Hi guys, I'm so sorry for the delay. We had a little bit of technical problems, but anyway, we got them resolved hopefully. So thank you guys for attending. And I think we have our speakers who are on here. We did not send out an advance agenda, but I'm just going to pull that up here so you can hopefully see my screen. You guys are all muted, but if you have any questions, you can go ahead and type them in the box. Since people are seeing my screen, they may see your questions, just be aware of that. But I basically have the dashboard, and if you raise your hand or have questions, then basically I can mute you, unmute you, and we'll go from there. So welcome again, and our agenda today, as you can see, is that we're going to do a few updates from different project leads. So Sarah Knapke has graciously agreed to talk about some publications, and then we will be talking about a hematology referral guide by Rose McGee, ASCO review by Katie and Cami, and then we will just talk about some upcoming things related to the annual conference. I was briefly going to talk about a cancer starter packet for this group, and then any other agenda items as well as our next call. So we'll go ahead and get started. This will be recorded, and so it will be archived. You can tell any colleagues that are not attending that there will be an archive later that will be uploaded. So with that, go ahead and I'm going to, Sarah, I think you might be unmuted. Let's see. Oh, okay. Sarah, it's saying that you need to enter like an audio pin in order to be unmuted. So that is the only thing with her. So until that gets done, let's go ahead and move to Rose. So Rose McGee, I just unmuted you.
Thank you. Can you hear me okay?
Yes.
Okay, great.
Like there was a little background for 1 second, but I'm going to go ahead and pull up your hematology referral guide.
Okay, perfect. So what this guide is, if folks aren't familiar, we have actually previously created solid tumor and I believe it's CNS tumor referral guides for definitely for genetic counselors, right, to be thinking about who should just have an automatic referral to genetics to consider genetic testing. So we did not have a hematological malignancy guide, so that's what this is. It's pretty short. I mean, there's not as much, I feel like, that are just straight referrals just based on tumor type. I will be happy to distribute this to the group for people's feedback. Our team here at St. Jude put this together, and so anyway, it's the same setup as the other two solid tumor and CNS tumor guides. As you'll see, there's a lot more, if you've seen the other guides, there's a lot more hematological cancer plus something else is going to be a red flag for a referral, and again, fewer just straight up referrals based on tumor type. I'm realizing just looking at this right now that I'm going to move the ALL or the lymphoblastic leukemias all together, and then the myeloid leukemias all together. I realize they're all kind of mixed together. If anyone has any feedback just looking at this right now, although I understand if you're just looking at it, you haven't had time to read it, that's fine. Or I can see if we can distribute it to everybody and get feedback from you. I don't know if it's smart to set like a time frame for how long we want people to look at it. Again, it's pretty short. I don't know if you have any thoughts on that, Liz.
Yeah, I think we were talking about maybe having a July call, so maybe we can maybe a week before so that you could discuss feedback then. So we don't actually have our July call date set, but I'm sure we'll aim for maybe later in the month. So let's just kind of get back with people, but certainly I can send it to the group, and then basically people can start to look at it, provide you feedback by email, and then maybe we could just have that deadline be whatever it turns out to be a week before the next call. Does that sound reasonable?
Yeah, that sounds great to me.
Okay, great.
Can you provide some education on the myeloproliferative neoplasms and what you're looking for with those?
Yeah, please do.
I'm asking if someone else can provide.
Oh, sorry. I thought you said, can I provide?
No, can someone else?
Sorry. What's your question? Sorry.
Yeah, kind of what are we looking for as an automatic referral with the myeloproliferative disease and neoplasms?
I guess if they have one, so if they have a myeloproliferative neoplasm, I mean, I think it's basically capturing that they have a myeloid neoplasm. Maybe that's too general. I could probably fix that or be a little more specific.
That would help, because I'm just not sure, like, if my providers asked me why I want to see them all, I don't know how I would respond.
Yeah, that's fair. Okay, I'm noting that.
My other question right off the bat was like excessive treatment toxicity, and in my mind what that means is like what I basically hear happens to kids with Fanconi, where they just have dramatic chemotoxicity and just their counts really drop. But honestly, providers have always described that to me as they melt with chemo, and I don't really honestly know. I've never seen it happen, so I don't really know, like, are you thinking anything beyond Fanconi that you've seen examples of, or kind of can better define what the treatment toxicity looks like?
Yeah, that's good. I will also work on that. Yeah.
Let me see if anybody, I'm looking at kind of the dashboard, so if you have any particular comments and you want to raise your hand, then I can basically unmute your line, because all except the speakers are muted right now. Okay. And then Sarah had the comment, I think, as related to the chemotoxicity. that she thinks that we can see kind of the melt or bad toxicity with CMMRD. So that's a valid point. And Sarah, it looks like you think that you are connected to audio now, so let me unmute you.
Can you hear me now?
Yes.
Okay, great.
Thank you. All right, so let me just pull up your document. Thank you, Rose. Okay, so go ahead, Sarah. So you basically are going to talk about publication efforts.
Yes, thank you so much. It's nice to be on the call with everyone. And we could probably lump this as a broader topic in terms of like publications and presentations. And I know that most of this is work that is happening by the membership, and we're, in addition to sort of fostering some of this activity, want to make sure we're just capturing it, since some of you are doing so much independently or with other groups beyond our subcommittee. So just thought we'd sort of highlight some things that we're aware of, as well as future ideas for publications that the membership might be able to work on together, or future meetings and our publications that we might want to target, and just sort of see if there's any discussion surrounding these topics. So you all are, I think most of you are aware that there have been a number of really fantastic publications that have included some of our subcommittee members already early in this year, including the paper, the comprehensive review that was published in the JGC by Sarah Scollin and all those who were involved. And I know we did a review of that on a recent call. And then also it came to my attention, and I'm hoping we'll have some opportunity on this or another call to talk about this amazing series that so many of our members were involved in. I think my understanding is it was sort of as the result of a workshop that some of our members attended for the ACCR, and now there's really a number of really wonderful publications on various topics related to pediatric cancer predisposition and clinical cancer research, and all of those articles are available online, and really, really well done so far. And I know I've been sharing it with our group here, and I hope everyone feels like they can share it with their internal groups, because I think it's really good. Just really highlights not only some really great topics, but also just how involved our members are and sort of how involved genetic counselors are in this discussion and this the progress on publications surrounding these topics.
Sarah, just sorry to interrupt you. Just so everyone knows, the final part of the series will be published on July 1st. So if you want to be able to look at all of them, look next week.
Great. That's exciting. So great.
And that includes one on specifically genetic counseling for cancer predisposition in children.
Awesome. Thanks, Cami. That's great. And then just looking forward to NSGC, we, as you all may know, many of our members were involved in proposing and are involved in a combined pre-conference symposium entitled, the title has changed a bit over time, but it's now the Expanding Genetic Counseling Landscape for Cancers of Childhood Brain, or excuse me, Cancers of Childhood, Blood, and Brain. So if you're going to the AEC, just be sure to check that out. A number of our members will be speakers in that AEC, or excuse me, in that pre-conference symposium. And then we also have a poster surrounding the survey that you all completed specifically for our subcommittee that was accepted, which Kristen has been involved in putting together, and a number of our other members have been involved in reviewing, etc., entitled Pediatric Cancer Predisposition, Genetic Counseling, Current Practices. So all that is very exciting, and I think is just great evidence towards how much wonderful work you all are doing, again, as part of the subcommittee, but also beyond. And then future publication ideas, I'm just sort of cataloging these here. So Liz, if you could scroll down a little bit.
Yep.
Just sort of cataloging these here. Some of these are ideas that we've had sort of right off the bat. Others are ideas that have sort of come to pass. But you know, we may do more with the subcommittee survey results. So if anyone's interested in working on that, you can let Kristen know, or certainly we've talked about maybe putting something together either for perspectives or for the Journal of Genetic Counseling. We've also talked about doing something to highlight sort of the intersection between somatic and germline testing. And again, I know we had an internal discussion about that on a recent call, but maybe getting something out there as it relates to pediatric cancer predisposition. Maybe looking by combining some sites and trying to look specifically at proportion of rare or specific tumors that might be associated with specific cancer predisposition syndromes. I know some of us struggle with finding that data in specific scenarios. So if you have anything that's of interest in that arena, certainly let me know and I can try to connect people. And then maybe even now in the advent of panel testing, some interesting case examples, things that we weren't expecting, or also, maybe finding individuals with more than one predisposition syndrome, something like that. It might be interesting to put sort of a case series together. I don't know, maybe we pause here and see if anyone has any feedback or ideas about future publication ideas.
Yeah, I think that's a great idea. And if anybody has a question, just indicate it in the question box or raise your hand and I can unmute your line.
And we'll give it a minute. If there aren't any specific comments right now, then you're welcome to email me after the call, or we can certainly sort of revisit at the end. I'll just sort of keep talking, and if anything comes up, Liz, let me know.
Okay.
Okay, so target publications, of course, there's NSGC's publications. ASFO has been a fan of these types of papers in the past, Pediatric Blood and Cancer specifically. It's a monthly journal and online only, and it's the official journal of the International Society of Pediatric Oncology. So it's a really well-viewed publication. Also, the Journal of Pediatric Hematology Oncology is an option, and those are sort of the ones that I sort of thought might be great places if we're trying to reach oncology professionals. The ASFO and the Journal of Pediatric Hematology Oncology might be great fits. And then just a summary here of meetings that are upcoming. I know we obviously know what's upcoming in 2017 with NSGC. As far as I'm aware, we don't have any representation this year, at least at the Association of Pediatric Hematology and Oncology nurses, but that might be an interesting place to aim in the future. Just because I think the nurses, as we all know in our clinics or in my previous clinical role, and those of you who are in clinical roles, sometimes the nurses are really some of our greatest partners. And then in 2018, I thought we could maybe talk about ACMG, which is in Charlotte, and whether or not there might be something we'd like to submit for the genetics community related to pediatric cancer predisposition that we might want to work on together. And then a couple of other meetings that are upcoming that are more oncology based are the ASCO meeting, ASFO, ASFON, as I mentioned, and then certainly the Leaf-Ramini Conference and Life Consortium. I'm not sure if that's happening next year or not, but put that on there sort of as a placeholder. So in my mind, sort of ACMG, ASCO, and ASFO might be really great places to aim right now, or brainstorm about where we might want to put some education out there. So again, happy to talk about ideas on this call or beyond. But bottom line is we're doing really, really amazing work and getting a lot out there pretty quickly.
For sure. Thank you.
I have a question about the Leaf-Ramini Conference. Does anyone know that it's not happening in 2017?
I thought I saw like a meeting announcement about like that it is in Toronto, is what I remember, correct?
But then I haven't seen that anything's actually been scheduled.
No, me neither.
Okay.
The last I heard was that they were moving it to 2018 because 2017 wasn't going to work out, but they were still expecting to have it in Toronto.
Okay.
But I don't remember hearing any specific dates yet.
Having served on the planning committee last time, it's largely like David Malkin led in the planning. So I think, physicians get busy, and so I don't know if like part of it might just be like getting a planning team really in place and mobilized, and it was an interesting experience, I will say.
And the other piece is if anyone is interested in sort of partnering together to work on some of these ideas or to be sort of on the publications work group, which technically right now is just me, then certainly let us know as well. That would be great.
Yes, thank you, Sarah, for leading this. I think definitely you're going to need some help and support, or just members chiming in, volunteering to really like get involved with publications if we're going to move to that next level as a group. So certainly encourage anyone with interest to reach out. And then congratulations again on the AACR. I know that was, I'm trying to remember which members were involved. Was it Cammie and Rose that were involved from this group? See, hold on, I think Rose is muted.
There were 7 of us.
Oh, wow, okay.
So it was, well, 6 from the group. So me, Rose, Sarah, Kristen, Kathy
Schneider.
I'm unmuting some people because I do
and Wendy
see
Coleman, who I don't think is part of our group.
Okay,
and
I
then
unmuted a few people. So Sarah, Martha, and Megan, you guys should be able to talk.
Hey, this is Martha. Yeah, the Lee Romini conference is April 26th through the 29th at the Hospital for Sick Children in Toronto.
Oh,
and I have to save the date. If anybody wants me to forward it to them, I'm happy to do that.
That is all I was going to say too, so I will just mute myself again. It's Megan.
Yeah, I'll forward it to the group, absolutely.
Sorry, I'm so sorry. I just realized all you guys with questions. I'm really poor at running these, so sorry about that. Okay.
This is Sarah Scullin. I was just going to say, so we're going to be launching the Pediatric Match clinical trial this summer. It's a COG trial that is kind of the pediatric arm of what was the adult match. So basically kids who are failing treatment, so refractory tumors, that type of thing, are going to have both tumor and germline sequencing done to look up for targetable agents. So I'm the chief genetic counselor on that study, and so I imagine that there's going to be, when we were talking about kind of thinking about publications or presentations as far as germline tumor match type stuff, I think there's certainly going to be stuff available coming out of that.
Cool. I'm glad to hear there's a genetic counselor involved in that.
Yeah, so it's right now it's most of the focus is on education of the oncologists because they're going to be getting these reports. I think the germline pickup is going to be somewhat low just because it's not, basically they're doing a somatic panel, but they're looking for any germline hits in those particular mutations. So it's not going to be like a full germline panel, but certainly physicians or oncologists are going to be getting these reports with germline information. So we're setting up a whole educational website and everything for them.
Cool. And that'll be publicly available to basically all pediatric oncologists?
It's so that's actually a good question. I don't know if it's just going to be if they're at a COG site or if it's. I think we're still determining who's going to access the site, but certainly any of the oncologists who are participating in the trial are going to be able to access it.
Got it. Okay.
Yeah. So I'll keep you guys updated. I think it's. I don't know for sure exactly. They're talking maybe. The second week of July that it might be starting to go live, but I'll keep the group posted.
Okay. Great, thank you. Okay, I'm looking up again. So, so a member asked who was speaking about pediatric match trial, and that was Sarah Scotland.
Yes, Sarah Scotland.
And I'm going to unmute the person that had that question. So. Anything else you want to ask, Adrienne?
No, just wanted to know. Thanks.
Okay, thanks. Okay. All right. And then Martha, did you have a question? Martha?
No, I was just raising my hand about the Lee Romini thing.
Got it. Okay. All right. Sorry. Okay, very good. Anybody else have any questions or comments about Sarah Napke's portion on publications presentations? Okay. Kristen, I was going to try to unmute you to talk about the poster if you wanted to, but it mentions you need an audio pin to be entered. So if you want to talk about that later, I would give you the opportunity if you're still there. Okay, so let me go back to the agenda. So I can also, when I email out the heme referral guide, we can also send the AACR link, or just actually I'll send Sarah's document in general. So that in there has the AACR link. And then as Cammie mentioned, there's also going to be another round of the AACR publications coming out July 1st. So keep an eye out from actually my oncologists are the ones that sent it to me, but yeah, those will be going live. And then next we are going to talk about ASPHO. Some of our members did attend ASPHO this year. So Cammie had a couple of presentations, and then Katie, I was loving her tweeting during the conference, so I almost felt like I was there. So Katie has graciously agreed to go ahead and summarize ASPHO for us. So let me make sure, Katie, I think you're unmuted.
Can you guys hear me?
Yeah.
Awesome.
I can hear you. It says can't be muted until you enter your PIN, so I think you're automatically unmuted.
Okay,
but
good.
Members, let me know if you're not hearing Katie.
And I typed up some of my tweets, which is how I take notes. So I'm happy to share that for you guys to put on or share with the membership of the subcommittee as a whole. And Cammie, feel free to jump in. I did not attend Cammie's fabulous talk because it was on inherited cancer predisposition, so maybe she can give us a quick update on that one. But I think there's only 4 or 5 of us in a... Sorry, Cammie?
Go ahead. I'm happy to, but you summarize everything else first.
I think there was like 4 or 5 of us there, and if you guys haven't been to ASPHO, I strongly encourage you to go. This year was in Montreal, so Pittsburgh is not quite Montreal, but it still would be nice because we really do serve as the genetics experts in kind of the front line in helping educate our fellow hematologists and oncologists colleagues. There were some great talks that were relevant to us that you'll see in the notes. One, we got a nice update on CRISPR-Cas9 and TALENs with some very technical details, which if you need a review, they're in my notes. But also they got into a good discussion of the ethics, and we had a nice representation of some of the questions that are coming up now that these are such accessible technologies. So it's nice to see that represented. There was a great talk on diversity and improving outcomes toward equity in relation to some of the sickle cell disease treatments, but then also some new words instead of cultural competency, using cultural humility, and some ideas to address that in our practice. That's always good reminders. You'll see those in my notes. I took a lot of notes on the new insights in inherited hematologic diseases. They had a great update on GATA2. So if you guys get patients referred with pediatric MDS, they said that GATA2 is the most likely genetic diagnosis, so have that in the back of your mind. There were some recommendations for testing. For instance, exome is going to miss about 25% of GATA2 cases because there's a lot of intronic mutations and deletions. So keep that in the back of your head. There was a great premier course on vascular anomalies. So if you are someone that sees those in your clinic, I have some notes on that and some of the somatic versus the germline testing that you should consider when you're seeing them in clinic. It was a busy, busy week, and it was wonderful. Cammie?
Oh, let me unmute Cammie. Okay, go for it, Cammie.
Okay, so I gave a talk at the very beginning and the very end of the meeting, and I also took note on a couple posters that I thought were interesting to share with everyone. But so my first talk was part of a panel on just cancer predisposition in children. We had Dr. Schiffman talk about how to identify patients at risk, including physical exam findings that I think the audience really appreciated. I tried to remind them, though, that not everyone has those findings. And then I spoke on the genetic counseling issues, what the process of genetic counseling is, pre-test considerations, ethical considerations, psychosocial considerations, timing issues, issues with choosing genetic testing and the most appropriate test, and the limitations to genetic tests. And we also talked about when surveillance recommendations should be followed, even in the absence of a molecular diagnosis. And then Dr. Garrett Braddour talked about the AACR meeting and the guidelines coming from that and what we do for surveillance. So it was a really kind of comprehensive overview in 90 minutes of what we all do every day. And then at the end of the meeting, I presented on somatic testing as part of a panel. That kind of the gist of most of the panelist talks was that we can do a whole lot, but we're not really sure what to do with it, and we rarely find anything that guides our management. But I got up and talked about how when we're doing this, the limitations to the somatic testing and the possibilities of finding germline implications for things. So gave some background information and some pre-test recommendations, as well as some post-test scenarios and suggestions. So that's kind of the overview of what I presented. I thought a couple posters, I can't find all my notes, but a couple posters that I still remember taking notes on that I thought were interesting, where there were several conditions where they're reporting cancer risk, at least in anecdotes, for conditions like Diamond-Blackfan anemia and IPEX, which we don't traditionally think of cancer predisposition genes, but I think that's partially because a lot of those patients previously did not live very long. So we may find that some of these syndromes that we're treating with transplant early are now having survivors that are living longer and are actually in our camp for cancer predisposition. And I also thought there was a case presented with Dicer 1 that was interesting, that it was a 13-year-old that presented with some of the tumors that we usually say happen in the first few years of life, which made me think that in my Dicer 1 families, I at least want to get a baseline, even if the kids are older. It was a scary case report that was presented. So that's what I got from ASFA. And Katie also gave a lovely talk that she failed to mention that I did attend and was really great.
Thank you.
Cool, thanks guys, that's really helpful. I just wanted to ask, as related to the GATA2 talk, was there anything public, like was there a publication that was referenced or anything with that 22% miss on exome data?
There probably was. That didn't make it into my tweets, but I have, it was Dr. Holland gave the talk. So when I send you the notes, it has who said what, so we can always reach out to them specifically too.
Okay. Yeah, I know that's like a concern for us. Like we always wonder when we're ordering from like Prevention Genetics or someone we routinely order from, are they covering that, the intronic? And then, you know, certain panels, like I think Claritas Genomics is one we've started using lately, and I think they specifically put on their materials that they do a good job covering GATA2, but we've had this debate among our team, like if we're ever going bigger and looking at exome, like how much that needs to be done separately or not.
We have that discussion as well, and we always, if we have an exome but we're suspicious of some of the GATA2 patients, we do order from Prevention. I have checked with them and they cover the intron 5 mutation pretty well. And you'll see in my notes too, they had a good discussion of some genotype-phenotype correlations that are coming out with GATA2. They see that patients with lymphedema are more likely to have a deletion. So some other things that can also maybe help guide your testing decisions.
Oh, that's great to know. Cool. And there's a question from a member, Katie, for you about what your talk was about at ASFO.
Ah, that's sweet. I work with Sarah Scullin on the Basic 3 project, so it's highlighting some of our Basic 3 data. We got some survey data from our parents who participated. We found that despite we're across ethnicities, so we have a large Hispanic population down here in Texas, parents want to be equally involved in the decision-making process, a collaborative relationship with their oncologist. Anecdotally, we were seeing that our Hispanic parents and our Spanish-speaking parents maybe weren't talking as much in the disclosures, which prompted me to look at if that was a preference or maybe there's a communication barrier. And it's not a preference, so we're looking into it as we think moving forward how to work with it and communicate with our parents.
Excellent. Okay. Very good. And then I don't see any other questions right now. So yes, Katie, if you are willing to share your notes, and if Cammie, I don't know if you want to share anything, but if you guys would like, I am happy to email that with the other materials that we send out from today's call. And then we were also wondering if anyone attended ASCO, and if so, wanted to talk about ASCO at all. So if you did, please feel free to raise your hand or ask, type in the question box, and I will. Let's see, I don't think I see any hands raised, so I'm taking that as a no one attended ASCO. Okay. Let me just check questions box. Okay. Then there's another question who says, can someone who attended the St. Jude Survivor Conference in Atlanta give an overview? I don't know, Rose, you're unmuted. I don't know if you attended that or if anyone else did.
I unfortunately did not attend, but our genetic counselor, Courtney Lewis, did attend. She works exclusively with our survivorship team, and she actually presented too. Unfortunately, she's not on this call, but we could possibly, I could ask her if she would like to. I don't know if anybody else on the call went. So if somebody else on this call went and can give us a summary, that'd be great. But if you guys would be interested. Yeah, Megan, are you on the call?
Yeah, I'm going to unmute her.
Oh,
yeah,
okay, perfect.
Unmuted. Go ahead, Megan.
Hi, I did attend. I should have thought to maybe actually pull my notes for this call, but just kind of a brief overview, and then, like Rose said, maybe Courtney and I can get together and maybe like jot down the highlights and send them to you if you want to send them around. But it was a good conference. It was my first time there. They opened up and started off with some basic conversation. Just Sharon Plan kind of gave everyone an overview of kind of the basics of genetics. I think nothing that a genetic counselor wouldn't already know. And then Smita Bhatia and Lindsay Morton and Steve Chanik kind of all coordinated their talks for the first day on, kind of had them all flow together. Smita talked about kind of survivorship research and survivorship care and the implications of genetic testing, mostly talking about some GWAS data. Lindsay Morton, who's actually one of my bosses here in the radiation epidemiology branch at the NCI, kind of talked about, and Stephen Chanik, kind of, they both, who's the director of the Division of Cancer Epidemiology and Genetics, kind of just gave a general overview about when we think about genetic. Lindsay kind of reviewed her paper that came out kind of looking at SNP data in radiation sensitivity to breast cancer, and then also went over the recent exome build that I was a part of for the CCSS, the Child Cancer Survivorship Study, that we're partnering kind of with multi-institutions, kind of looking at full exome data on about 5,000 childhood cancer survivors. So she briefly just kind of cursorily went over those and then kind of drew it together kind of into a larger implication of kind of how we need to be looking at genetic variation kind of on a somatic and a germline level as far as implications for cancer care in survivors. And then the second and third days were a lot of just rapid fire platform presentations on lots of specific studies. So again, that it's hard to kind of go into that, but I did write down some of the big highlights, and I can get that out to the group. So that was really kind of how they organized it for the second and third days. And then the last day, they kind of brought it back together with a really interesting conversation on like ethics of return of results and legality of return of results. They brought in an MD-JD to kind of talk about like the intersection of HIPAA and CLIA and federal regulations with institutional liability, which was quite interesting. And again, I don't know how much we want to talk about that now, but I can send out the highlights from that. And then Courtney gave a great talk at the end, just talking about, you know, considerations of genetic counseling for adult survivors and what providers should be thinking of and keeping in mind when they're seeing their patients in clinic, and what, you know, genetic counseling can do for them. So it was overall a really great session with a really broad range of people there.
Cool. I will say that our oncologist who attended came back and sent information about the session with the JD and the legal and ethical. And I think that was very eye-opening for him. So was anything news to you, Megan, or do you feel like as genetic counselors it's stuff that we kind of recognize? But maybe it was just more for oncology.
One of the biggest things that this, so I'm trying to think who it was. It was Ellen Clayton. So I had actually heard her name because she's on a bunch of she's on the Emerge, which is that whole EMR working group or task force. So she's on a couple different task forces, but I guess she's a MD, but she's trained in law. And so the one thing that she felt very strongly on, which brought some discussion, was return of research results and how she believes the law is specifically written. So, and that had been so I was at the CCSS meeting that was immediately before the survivorship meeting. And there was a lot of conversation there as well, because there's a lot more variability than I realized between how different centers will return research results. And just in even anecdotally having these hallway conversations as we were having these talks, and then we all, broke, some groups will return, will have a research result and they'll return it to a patient and then say, now we have to get you CLIA confirmed. We're not going to act on this until it's CLIA confirmed. And then there are other groups that say, we won't return a result that way. We will get blood and we will Sanger confirm it ourselves, and then we will return the result to the patient only then. And so there was a lot of question as to liability, and the way that she interprets the law is you absolutely cannot return a result unless it is CLIA confirmed. And I'm trying to find, because I did jot down some stuff from her. As far as she had specific, and again, I can send this out, but she had specific languages and citations in the law where she brought this up. So that was it was interesting, and then also it brought up a lot of discussion because, again, I did not realize that there are groups approaching this in many different ways, and so then it brought up a lot of conversation about liability. She did say, when someone stood up and pushed her on it and said, well, we've always been just returning our research results and then getting them CLIA confirmed. She brought up well, I don't know of any specific case where, people have been penalized for this, but if you want to ask me how the law is specifically written, that's how the law is written. And she also brought up a good point that the regulations as they currently stand are more focused on protecting the individual's control than really all these ethical debates that we're having. That she went through a bunch of different case examples and showed how it, every time it won out in the case of individual protection. The other big thing that she brought up when she was bringing up case presentations was, there's been a lot of conversation even within, I'm part of a national family history working group, and there's been a lot of question. We've brought the HIPAA people in a few times because there's been, some question around how HIPAA is written and what is our duty as far as informing family members and how far can we take that, right? So am I allowed to just call, the sister of my patient if she says it's okay to let her know that the sister has a BRCA mutation? Or what if my patient says, no, you absolutely cannot, we know that that could do harm to these other family members, but our duty lies with the patient, but does it, everyone had these questions, these different clinical scenarios, and what would I do in this case? Who am I allowed to talk to? Where would my liability stand? And so she gave a bunch of historical examples of there was one example of a patient who had died of clear frank FAP, polyposis, and the physician who treated that patient who had died, many years later, like 30 years later, that patient's daughter got colorectal cancer because she also had FAP, and then it was all figured out that that's what she had and everything. And so she sued the clinician saying, this was something that you should have informed me of. And the court sided with the clinician saying, no, he had no duty to warn this patient who was like 2 at the time, but also just kind of citing, setting a precedent of the clinician only has the duty to warn the immediate family member and does have the responsibility of informing the family member that their family members are at risk and other family members should know, but that their liability stops there. And there was like another case of a RET mutation that was the same thing, like a mom with a RET mutation, and the clinician had said, you need to let your other family members know about this. Daughter ended up with medullary thyroid cancer, sued, and they sided with the doctor, saying, no, the doctor did their due diligence. Their only responsibility was to mom. So that was another big discussion was that, like HIPAA. And she argues that HIPAA makes it illegal to inform family members outside of specific patient approval. So, I think she scared a lot of the doctors in the room because, they were like, so unless I have like specific written signed permission from the patient, like I can, because I think especially with genetic counselors, like if our patient is saying, yes, it's okay, we work with families a lot more, and I'll never cold call a patient, but I think, we have some things in place to get permission from the family member to contact family members, and then, if family members reach out to us, we have no problem kind of working with them. But it was definitely for some of the clinicians in the room, they were getting up and asking a lot of questions surrounding that.
Mm-hmm. Thank you. That's very helpful. Okay. Any other questions or comments? All right, cool. So then the annual conference, Michelle was going to be in and out on this call. So Michelle, are you there? Do you want to talk about the pre-con again at all?
Hi, yeah, I'm here. I won't say too much more just because I know Sarah already brought it up. As far as I understand, the title that Sarah gave you all is the final title, and it shouldn't be changed again, so that's good. We are, like as a group, we are working really hard. We're starting to, make an outline of slides and things that we'll talk about. The pre-conference symposium will touch on pediatric and adult cancers topics. Obviously the childhood cancers part will focus on that, but the hematologic malignancy and brain tumor part will be adult and pediatric, in addition to a section that we'll have on ethical considerations or clinical quandaries, and that will kind of cover all the topics that we're going to discuss. So we're really excited to be putting this together, and hope that that any of you that are coming to NSGC will also come to the pre-conference symposium. If you do have any specific questions about anything related to it, please feel free to email Liz and myself, and we can get those questions answered for you.
I would also put a plug if you have specific messages that you would like to get out to other attendees, please let us know that as well.
Great. And then basically, as was mentioned earlier as well, we did have our poster on the pediatric subcommittee data on kind of our practice patterns. It was kind of like a mini PSS survey. So Kristen Zajo was leading that poster effort. And so definitely look out for that poster once it gets closer. We'll let you know kind of the poster number, but we'll also be advertising that at the pre-con symposium. And then I was just going to briefly drum up, I had not followed up on this, and I apologize, my plan related to a cancer starter packet. I have mentioned on our previous conference call that for those of you who have been around as members of Cancer SIG for a long time, you might remember that the Cancer SIG created what they call a cancer starter packet, but it was quite a number of years ago, but the goal of it was basically to equip members who are new to cancer as an area of practice with kind of a basic toolkit that kind of had even like example letters that you might send out to patients, or like results templates, or kind of outlined a lot of things need to know about practice, like how to advertise your practice to referring providers. So anyway, it was a very comprehensive toolkit, and I still have it printed on paper, but if anybody knows if there's an electronic copy, it might be within the Cancer SIG, but I haven't gone to look, to be honest. But I still have a paper version of that, and I was wondering, for those that are newer to pediatric cancer practice, if it might actually be helpful to think about assembling like a starter kit that new people to cancer in a ped setting would just have this. And so I've talked to a few members within the subcommittee about that, and I think we kind of felt that maybe a needs assessment might be helpful, and that's why I was planning to do a survey monkey to just kind of get more about member needs. We did ask some of those questions already in our survey, but not really very specifically about like exactly what counselors might need in starting a practice. So I'm still planning to try to put some questions together on a survey monkey to just kind of start a needs assessment. But if you do have any questions, like particularly if you're new to practice, your perspective is very valuable. So even if you'd want to take this project off my plate, I'd be happy to have you do that. I'd be happy to give you like what the original cancer starter packet looked like. And then if you want to start about thinking about questions or something that would be relevant, that would be great. So in summary, looking for either a project lead or just if you have feedback on a cancer starter packet, I think it would be kind of a cool project to work on. So anybody have any questions or comments about that? I'm going to scroll through, make sure nobody's raising hands or asking questions. Okay, I don't see anything new. Okay, and then the other thing that has kind of been fledgling as a project is doing a kind of comparison about different labs that are offering somatic testing, particularly as related to like focus on peds cancer. I don't know that there's as much of a need for this as original, because I think when we started talking about this, it was a few years ago when there were fewer labs in that marketplace. And I think now more and more people are going to be doing things like Pediatric Match or doing things like whole exomes. And I've also heard, I think through the Cancer SIG, that there might be another group doing that for adults. So I don't know that it's as peds relevant. So Danelle Pond and Rebecca from Cincinnati were originally working on that, but we haven't gotten any updates about that. So does anybody have any thoughts on either the need for that or any interest in kind of participating as a member to reinvigorate that? I don't see anyone itching to respond on that. So for now, that's kind of tabled because we don't, have anyone working on that. And then
this is Cammie. I think it would be really nice to have, because I feel like I need to provide guidance to my oncologists as far as what their options are and what the pros and cons of those options are. But the reason I haven't done it is a lack of time, and depending on how much we value that and how much we need it, I agree with tabling it just because I know we all are short on time. So I think if someone has the time and energy to do it and they're just going to do it anyway, it would be nice to put something together.
I don't see any new hands on that. Unless Megan, your hand is like raised. Megan, did you have something to say about that?
Oh, I'm sorry. My hand was just raised from before.
Oh, got it. That's what I kind of thought, but I wasn't sure. Okay, thank you. Okay, and then as far as new members go, I did receive an email during this call about adding a member. So we will work on that. And then I think we have a new member on the line. So let me see if she is still on here. So Michelle Disco, I think you're new to us. Do you want to introduce yourself? I don't know if she is actively listening or away from her phone. Okay, well, Michelle is new to us, and then everyone else, I think, that is on the call, I recognize, so I don't think we have any other new members. Okay, and then
we should get a new member soon, and that Emory now has a genetic counselor in pediatric oncology.
Okay, Emory. Okay, great. And then, like I said, it looks like there's another one at University of Kentucky or in Kentucky. So let's see, Justine Cooper had emailed me. Justine, do you want to introduce your colleague? Are you there, Justine? Okay. And then, Michelle, did you want to talk about Journal Club in July? Potentially?
Yeah, and I'll just, I'll just take a minute or two, just real quick. So for our July meeting, at least for part of it, we'd love to do another journal club. If possible, I would love to have a volunteer or a couple volunteers for that. I had a few ideas for, possible journal clubs. We could always pull one of the new AACR articles and discuss that in more detail. I did a quick PubMed search this morning, and there was a couple of recent articles on ethics in childhood cancer, importance of updating family history in childhood cancer survivors. So if people aren't connected with the childhood cancer survivorship group at their location, that might be a good topic to kind of dive into a little bit more. And then also the GATA2 stuff has come up. So if there's an article that we can find out there, that would be another interesting topic as well. So, or if someone has a topic that they're interested in, we could absolutely talk about that instead. So if you're interested in doing that, please contact me because we would love to be able to kind of make sure that everyone's aware of these new publications that are coming out and how it might impact their practice or help them out in some sort of way. And so if anyone's able to commit to presenting even just a quick summarization of a recent publication, that would be fantastic. So definitely let me know. If I don't hear from anyone, I might reach out and see if I can beg someone to be a volunteer. So just a heads up that may happen as well. But otherwise, hopefully we'll do that in July, and we'll coordinate dates and try to figure all that out soon. I think that's it.
Okay. All right. Well, it looks like we are at the end of the hour. So with that, I think if anybody, I will just look for any final questions or comments. Doesn't look like we have any coming through. So Sarah, did you have anything to say or no? That might be it.
Yeah, I just had a question about where the automatic referral list that we did for the solid tumors. Were we going to vet that through oncologists, or is that because we actually just did a presentation for our oncologists, and I didn't know where we were as far as distributing that, or if we wanted to pilot it, or where that stood.
Yeah, that is. I'm so glad you brought that up because I almost completely forgot where we were with that. So where it was at is it kind of got we are approved to basically use that as a SIG and put NSGC logo on that for internal use and distribute it. But basically it would need board approval, I think, or they were checking on that if it would need board approval or something if we wanted it to actually be disseminated through NSGC.
Okay.
And then so it would be a higher level. So I think we were also thinking if it's going to go up for board review and become a more official document, then we probably should do some vetting, or at least, I think I've tried to make sure it's pretty consistent with the recent publications, but all those publications also came out kind of after the original referral guide. But that is something that we are also planning to talk about at the pre-con was the development of the referral guide, So I think it would be awesome if anybody did want to do any official piloting, give any feedback. That would be great so that we can kind of, you know, think about disseminating it. I mean, in my mind, it kind of got put on the back burner after all the publications came out because I was like, I don't know that there's the same need now that there's like official published guidelines, but that's just my thought.
Is it something that others have given to their oncologist, or are you guys mostly just using it yourself?
For me, I have given it, like when I've given like our Commission on Cancer talk, I've always left it in the back of the room, or I've mentioned it at tumor board and put copies, but like I will be honest, no one's ever taken them. They just still just come and ask me. Or like, so that's been my experience, but anybody else? Rose, did you want to say something about that?
Yeah, am I muted? No.
Nope, you're fine.
Oh, good. Yeah, I've definitely sent all of the guides to our team, which includes oncologists, geneticists, others. But the feedback that I always get is that, well, we need genes, we need references, we need, like, I think they're looking for something a lot more comprehensive. Now, that's only one institution and the opinions of my team, but I imagine that might be some feedback. If it's not just for genetic counselors or, you know, if it's for a wider group like an oncology setting, I imagine they're going to want a lot more information included than just the tumors to refer.
Yeah, and to that point, Rose, once the publications came out, I felt like that was well referenced and there was like kind of the support there for that. So I'm like, well,
right.
You know, I don't know if this is more moot now, but I feel like the people I work with, they often want a quick and dirty also. So I don't know. There could be still an appeal to certain groups, I think.
Yeah.
And certainly I think it's still helpful for like members of the subcommittee or like new people that are new to pediatric oncology as genetic counselors that kind of want that as a tool. I think it's still very helpful with that.
Yeah, I agree.
So I can certainly slap the NSGC logo, like we got permission to do that, to like put the NSGC logo on and put it in our resources for our SIG. So I can definitely do that, and then I can email that out with the other materials. And then we do have another member who was submitting some comments. So Nina, do you want to go ahead and talk about that real quick? Sounds like her oncologists were more excited about the AACR. Oops, maybe that's your background, sorry. Nina, are you there? Okay, well, I'm going to mute her back, but she said her oncologists were more excited about the AACR guidelines or AACR articles than the guidelines that she had sent, but that she found them as a new ped heme counselor very helpful. So yeah, I do think there is still a need. So I will basically get that with the NSPC logo, but I think, you know, in terms of broad dissemination to oncologists, we might still, I'll circle back with kind of the cancer SIG and the kind of reporting chain, but I think that was the last I heard that it might need like board approval or review.
Okay, thank you.
Yeah, thanks. All right. Well, thank you guys. This is a great call. I appreciate everyone's participation. And we will be in touch with all these materials. It may take me a few days to get them all assembled, but we'll get that to you. And then once Michelle and I and whoever, if you want to do the journal club, we'll probably plan the date around you. So if you can let Michelle know sooner rather than later, if you're interested in that, then that'll help us in the planning the date. But I think we'll probably aim for end of July. All right. Thank you, guys. Have a great day.